a solution for non-flossers, women in dentistry, and more. Hi, I'm Allie Cook for the Dental News Network. Today is January 30th, 2013, and this is your Wednesday Watch. Here is today's dental news, brought to you by Dentsply Caulk. Americans are not consistent about flossing their teeth as recommended. While this news probably doesn't surprise you, results from a new study just might. Researchers at the University of Nebraska Medical Center College of Dentistry have determined that newer irrigation devices are just as efficient as flossing. For those who are uncomfortable flossing or simply just forget, this new twist to the oral care regimen may do the trick. The University of Michigan School of Dentistry is exhibiting its groundbreaking history at its Dentistry Museum. Women graduated from the UM Dental School as early as the 1800s, and it also admitted the first African-American student to study dentistry. The exhibit is called Women Dentists, Changing the Face of Dentistry, and includes photos, notes, and articles from university alumni journals and dentistry publications. Coming up, a special report, but first, here is a message from our sponsor.
Introducing the incredible everyday adventures of DDS Dan, a world-renowned dental practitioner from Milford, DE. Dan is tackling some of the most baffling questions in dentistry, day and night, solving everyday dental cases and making the world a better place, one restoration at a time. Keep watching for more adventures and keep using TPH3 every day.
Here is a special report for our Wednesday Watch viewers. We're now joined by Dentistry Today's editor-in-chief, Dr. Damon Adams, who is here to tell us more about the February issue.
Thanks, Allie. I would like to take just a couple of minutes to introduce what we've just published for you in our exciting February issue of Dentistry Today. This month's issue includes a number of articles dealing with recently introduced materials and some new ways to think about dentistry, dental techniques, and dental concepts. Isn't it incredible? Every time we think about it and we think we've got it all figured out and that there simply could not be any more improvements or different ways of doing things, it seems that something new or better comes along. In our covered feature article this month, we are proud to present an exclusive interview with Dr. Frank Spear. Dr. Spear is the founder and director of Spear Education, and he has positively impacted and touched the lives of many of us in the dental profession. In this candid interview, Dr. Spear shares what he sees as the biggest challenge for dentists and emphasizes that there's more to dentistry than simply mastering techniques and materials. The essence of success in treating patients is rooted in the ability to communicate with our patients, to properly plan for treatment while fully informing the patient of the choices on the table, then to effectively deliver that chosen treatment. In addition to a number of other great clinical articles in February by leading clinicians, we also have an interesting peer-reviewed CE article for you. It's written by Dr. Jennifer Byron et al., and it's on allergic contact stomatitis. Dentistry Today is a PACE-CERP national sponsor, and by reading this article and successfully completing a short quiz in the magazine, you can receive 2 MAGD FAGD credit hours. Or you can simply go online to dentalcetoday.com to read the article, take the quiz, and then immediately download your CE certificate. Also this month, be sure to have your whole team check out Lisa Wadsworth's article in our recently introduced Hygiene Today section that will run 4 times in 2013. Lisa is our featured hygiene author who discusses implant maintenance issues related to the work of the dental hygienist. As always, we certainly hope that you enjoy and benefit from reading our February issue of Dentistry Today.
Thanks, Dr. Adams. And now, today's innovative product. This week, we're taking a look at SDR from Dentsply Caulk. Here is Dr. Alan Atlas to tell you more.
Hello, I'm Dr. Alan Atlas, and I'd like to talk to you about SureFill SDR Flow. Since its release in 2009, SureFill SDR Flow has been a game changer in dentistry. It has revolutionized the way we place posterior composite restorations. If we evaluate the prerequisites for a successful restoration, how the composite is placed and what material we choose become critical to the clinical outcome. Research has shown that the deepest part of the cavity and the proximal box are the areas where polymerization stress and polymerization shrinkage are most affected when the composite polymerizes. SDR flow chemistry incorporates a polymerization modulator that actually offsets the polymerization stress that occurs when the composite is light cured. Perhaps the most compelling research out there that demonstrates how good SDR flow is the use of optical coherence tomography to assess defects in restorations. SDR flow showed no gap formation upon light polymerization, where other flowables showed incredibly large gap formation under the same circumstances. As the old expression says, often imitated but never duplicated applies to SDR flow. Several competitors have come out with their versions of low stress, bulk fill composite materials, but frankly, they don't measure up to SDR flow in the physical properties necessary to achieve a successful clinical outcome. The dental literature demonstrates that SDR flow not only has the best stress reducer available in the market, but improved material properties like fracture toughness and plastic deformation due to its high elastic modulus that is necessary to withstand the forces of mastication. Whether it is in the hands of my dental students at the University of Pennsylvania or for utilization in my own private practice, SDR flow has been shown to be easy to use, reliable, and deliver outstanding and consistent clinical results.
Thanks, Dr. Atlas, and thank you for checking out the Wednesday Watch. We'll see you next week with more from Dentistry Today and DNN.